given that we now know what people in alkalosis and acidosis are going to look like, what their behavior is going to be like, let's look at what would cause you to have some disruption one way or the other in your acidosis alkalosis. So let's look at this logically, all right? Remember, you're moving acid into your body, you're also moving acid out. What if you put too much acid in? Yeah, acidosis. What if you don't let enough out? Well, yeah, that's also going to cause too much acid. What if you don't let enough base in? Because base will neutralize the acid. So if you don't put enough base in, but you put in the normal amount of acid, yeah, you're going to end up with acidosis. And what if you put too much base out? Let's say you're putting in the right amount of acid, but for some reason you're excreting too much base. That would also cause acidosis. Now, are all those equally likely? No, no. But it's important to realize that each one of those is a distinct possibility. So that diagram on the right is really very good. You've got acids and bases coming in. You've also got them going out. So there are 4 places, basically, that you can disrupt the whole process, okay? So, 2 for acid, 2 for base. And then each one for acid and base, either too much or not enough. So causes of alkalosis, it's the same thing. You either put too much base in or don't let enough base out, therefore it builds up. Don't put enough acid in to neutralize, all right, and or let too much acid out, okay? Again, not all those are equally likely. What we want to do is look at some of the most common ones, and I do expect you to know a few of them, all right? I'll try to let you know as we go. Nice chart on the left, European again, interesting. So, that's kind of fun. You go through there, and it's going to be a great summary. Well, summarizes what we do, and then talks about even more, I'm pretty sure, so... Let's talk about respiratory acidosis. Now, you should be able to think for a minute, all right? So this is what we mean by respiratory acidosis is an acidosis that is caused by the respiratory system. So remember, let's go back. How many breaths per minute do you normally take? 12 to 20 if you don't breathe enough versus if you breathe too much. What happens if you don't breathe enough? If you hypoventilate, you hold CO2 in. CO2 is acid, therefore respiratory acidosis. So this would be, if you hypoventilate, you will end up with respiratory acidosis, all right? So what will cause that? How about COPD? All those people with severe emphysema, chronic bronchitis, those people as lifelong smokers, all right, they now can't get enough gas exchange going on there. Their lungs just don't work well. And so CO2 builds up inside, all right? COPD. CO2 builds up, respiratory acidosis. Pulmonary edema, okay? So remember pneumonia or left side congestive heart failure. We're going to fill up the lungs with fluid, all right? And that, in turn, respiratory acidosis. Airway obstruction, pulmonary edema, because you can't exchange gas again. You can't do gas exchange, therefore CO2 builds up. You can't get it out. Airway obstruction, asthma, cystic fibrosis. Once again, if you can't get the CO2 out, it builds up and you become acidotic. Depression or injury to brainstem respiratory centers. So this can go either way, but a lot of narcotic barbiturate overdose will result in an acidosis, a respiratory, all right? So narcotics, especially like heroin, you see the poor, who knows what addict in the lower right, but assume he's heroin. So heroin depresses respiratory centers in the brainstem, in the pons, in the medulla, so you don't breathe enough, therefore you become acidotic. Remember, what does a person in acidosis look like? It's the orangutan. Oh, what to do, what to do. So what are heroin addicts going to be like? Yeah, they're totally just, gassed out. They got nothing. Central nervous system, depression, depressed reflexes. That's what these people are going to be like. Okay, barbiturate, same way. Stroke, tumors, trauma to the brainstem. So in this case, a stroke or a tumor can do almost anything to your brain, but that respiratory acidosis, if it's in the medulla or pons that controls respiration, then that could cause hypoventilation. And also, never shake a baby, the shaken baby thing. God, when people shake babies still, their heads are proportionally too large for their bodies, so that head snaps back and forth, and you can do really serious brainstem injury there. If you ever see somebody shaking a baby, just don't... if you need to, just dial 911. You should step in, get help from people. You can't do that to a baby, all right? So, So what would cause respiratory alkalosis? All right. So, well, we know already hyperventilation. Okay. So if you're breathing more than 20 times per minute, you're blowing off way too much CO2. So you end up with respiratory alkalosis. Anything causes hyperventilation will do that. So pain, when people who are in pain will breathe faster, they'll hyperventilate. So expect them to go into acidosis. Anxiety can do that. All right. Panic attacks. So these things may all cause you to breathe way too fast, and so you end up going into respiratory alkalosis. And remember, what's the behavior of someone in alkalosis? Remember Alkalosis, the boy who killed with a rake? These people are, hyper reflexive, hyperactive. So they are spasms, tetany, convulsions. All right, so brainstem injury can do this as well. Improper ventilator setting. Here's a favorite way nurses kill people. You got somebody on a ventilator. Boy, how relevant with coronavirus, huh? What if they're unconscious? And you got tons of people to care for, and you don't get back to someone. You're doing it in a big hurry, and you set the ventilator wrong, and you don't get back to them for like 30 minutes. They may be dead by then. All right. I mean, if they're comatose, they can't really go through all this stuff, but they'll sustain very serious damage. Significant hypoxemia can cause this. All right. So high altitudes, hikers up there. All right. So now looking at causes of metabolic acidosis. So we're talking about now acidosis caused by something you put into your body, or your body's inability or excessive ability to do something. So let's just take a look. What if you put in too much hydrogen? All right, how could you do that? Well, aspirin overdose. Aspirin is salicylic acid. It is an acid. So you got things like this, in the lower left, Bayer chewable, cherry flavored. Wow. It's low dose baby aspirin. So you got a little kid with a fever, and you say, here's some medicine. It's good for you. It'll make you better, and it tastes good, and it's chewable. And the kid says, wow, this is great medicine. And then mom's not home, and the kid sees the bottle and says, this is medicine. It's good for me. It'll make me better, and eats all 36. This kid's now in acidosis, okay? And remember, what's the behavior of someone in acidosis? The orangutan, depressed reflexes, sluggish. That's what a little kid's going to look like who's eaten a whole bottle of Bayer chewable, cherry-flavored aspirin. You got to get that kid to the hospital like ASAP. Excessive alcohol intake. Alcohol also works like an acid in the body. So think about alcoholics, chronic alcoholics. They're sluggish. In other words, it's not just that they're drunk. It's the acidosis as well that makes them, kind of confused and disoriented and etc. Right? Too much ketone. So remember, we talked about ketones metabolism. Ketones are made, it's beta oxidation makes the ketones. That happens sometimes when you don't have enough carbs. Remember, fats burn in the flame of carbs, so in a carbohydrate flame. So sometimes people who can't use enough glucose to do lipid metabolism will cause a backup or a backlog, an overload of ketone bodies. Ketone bodies will lower pH, and that produces ketoacidosis. Ketones, by the way, it's a carbonyl group with a couple of things stuck on it. So that's a standard chemical group. So these are all ketones. They're very useful. I mean, your body can use them, but it's just if you have too many of them, they will lower your pH. Now, what kind of person might not be able to use glucose like most people can, therefore not have that carbohydrate flame that the lipid metabolism likes to burn in? Yeah, diabetics, they can't use glucose as well. Therefore, they end up with a special condition called diabetic ketoacidosis. So diabetic ketoacidosis, you've got diabetics can't use glucose, relying too much on lipid metabolism, not being able to do it efficiently. So build up the ketone bodies, lower the pH. Now there's a type of breathing. What would you expect to see in a patient with severe diabetic ketoacidosis? They are way too acidic. How would the respiratory system respond? This is kind of the question I would ask on a short answer. You should be able to figure that out. Yeah, they'd be hyperventilating. And in fact, there's a term for that with diabetics. It's and it just flew out of my head as I said it right now. It's something that I know very well, and I talk about all the time, but I just can't think of it now. It'll come back in a moment. So starvation can also cause ketone production if you start relying on proteins in order to produce your ATP. You end up also producing too many ketone bodies. So the breathing is Kussmaul breathing, Mr. Kussmaul, Dr. Kussmaul, Professor Kussmaul, I don't know. Kussmaul. So, but it's MAUL. Diabetics basically frantically. This was like a diabetic on death's door back before we had control like insulin and stuff. Diabetics, as the last thing it would be doing basically is frantically trying to get CO2 out of their body, and it doesn't work because remember, respiratory is not as powerful as urinary to affect acid-base balance. Okay. So starvation, people on ketone diets can get this way sometimes as well. So it's usually not critical, but it can happen. Increased lactic acid production. So like after a heart attack, your heart can't do aerobic respiration, so it starts into anaerobic fermentation, starts creating lactic acid as a byproduct. So lactic acid with several disease conditions can build up. And so that's the problem. Poor person, not only are having an MI, but they're going into acidosis. So very strenuous exercise can do that. Not very often. You have to be like Olympic level, I think. Acute MI with heart failure, all right? Can't, not able to clear that lactic acid without oxygen present. So convert it to pyruvate so it builds up. So causes of metabolic acidosis. So now we're again talking about things that are causing you to have too much acid, but it's a metabolic cause, not respiratory. What if you lose too much bicarb? Who might do that? Severe or chronic diarrhea. So you're constantly losing both fluid and electrolytes, and a lot of people with chronic diarrhea will drink fluids, but you've also got to get the electrolytes back, okay? So, and the acids again so it's not spending enough time to get neutralized, to reabsorb. So overuse of laxatives, again, we've got to do in the colon, we've got to do that reabsorption, all right? And if we're not able to do that, if it passes through too quickly, we are putting out too many solutes and we end up in acidosis, all right? Colostomy or ileostomy, that's a problem here where people have a rerouted colon going into the colostomy pouch, so it can't be reabsorbed in the colostomy pouch. So, and if you're not making enough bicarb, so kidney disease. If you're not secreting enough hydrogen, kidney disease, okay? There are lots of different, anything wrong with your kidneys obviously can affect your acid-base balance, all right? So, there you see Al Abi's Mexican restaurant. Sorry you experienced explosive diarrhea after dining one of our 5 establishments. Hope that this will not deter a return visit. And please bring this postcard into any Al Abi's. 10% off, all right? Only proof of explosive diarrhea from last visit may be required. Okay. Causing metabolic alkalosis now instead of acidosis. So too much bicarb in. Who could do that? Sodium bicarb products, okay? Like antacids. So again, you got the little tiny kid, Tums, it's wintergreen flavored. Oh, it's delicious candy. Little kid eats 5 or 6 rolls of Tums that he finds in mom or dad's drawer, and now you got somebody who's got way too much bicarb in your body, because that's what an antacid is. A lot of it is, magnesium bicarb, whatever, aluminum bicarb. I don't know what all they use, but it's bicarb. All right, so. And remember, what's the behavior of someone who's in alkalosis? Yeah, the boy who killed with a rake. So this kid is going to be convulsing and spasm and so on and so forth, all right? Too many rolls of Tums, that'll do it. Chronic emesis, if you're vomiting too much, you're losing acid, okay? So too much acid is lost, all right? You can go into alkalosis from that. Gastric suctioning, somebody has to get their stomach pumped, as you've heard it always described. So if you pull out the acid, then you are creating an environment that is too alkaline, okay? And that's rare, but metabolic alkalosis is, but still can happen. And yeah, I know that lasagna gives you heartburn, so I mix some Tums into it. Wintergreen lasagna. So how do you compensate for pH imbalances? Well, respiratory system is relatively fast, but limited. It's not as powerful. It's faster than the chemicals, not as, Slower than the chemicals, faster than urinary, but it's not as powerful as urinary. Hypercapnia stimulates pulmonary ventilation. So remember, hypercapnia is the buildup of CO2. What's that going to cause you to do? It's going to cause you to breathe faster, to get it out, all right? Hypocapnia reduces it, just the opposite of one another, all right? Renal compensation, slow, powerful, all right? Takes a long time, hours, days, but it's much more powerful, okay? Effective for imbalances of a few days or longer, all right? Acidosis causes an increase in hydrogen secretion, okay? So remember, you can, the kidney can move bicarbs and hydrogens between the tubular fluid, so that's what you got to do there. Alkalosis causes secretion of bicarb. And that's why, once again, anybody, you've got a person on the left, anybody who's hyperventilating, breathe into a bag, you get that CO2 back in. And choking game, another way to mess around with acid-base balance based on CO2 and CO2 sensors. I figure all the people who did the choking game in middle school are the ones who grew up to do erotic asphyxiation. Which statement is false? Sweat ultimately comes from your ICF. Aldosterone increases blood volume. Sodium is the principal cation of the ECF. A typical human has about 40 gallons of fluid. Effects of hypochloremia mirror those of hyponatremia. Okay, stop the video. Wait until you can answer it, and then answer it, okay? So there you go. A typical human has about 40 gallons of fluid. Okay? Typical human has 10 gallons or 40 liters, a 150-pound male. All right? Sweat does come from your ICF. Aldosterone does increase blood volume by saving sodium. Water follows solids, saves water as well. Sodium in the main cation of ECF, and chloride goes wherever sodium does. So whatever is happening with sodium happens with chloride. Now, arterial blood gas analysis. I'm going to do a whiteboard presentation on this, and you have a homework assignment. This is actually very easy, and I don't know why some people think it's complicated. All my students have said that the way I have them do it makes it really super easy, and every year when I give it on exams, it's like the one part of the exam that everybody aces. So it's really very, very easy, and I'm going to show you how on the whiteboard. And I also have instructions on your homework. The instructions tell you exactly how to do it. So the whiteboard is just to do it, in person and animate it so you can see it happen. But let's just talk about the basic idea here. Arterial blood gas analysis used to determine primary cause of acidosis and alkalosis. This is, remember, and who in the hospital does normally gets that arterial blood? Usually the respiratory therapists. Those people definitely should get paid more. They're awesome. They know what they're doing. One of my former students right now, respiratory therapist, working with COVID-19 positive patients. She's out there on the front line, risking her life every day. She is awesome. Oh, Taryn, I love you to death. Stick with it, girl. Stay safe. All right. So it's the respiratory therapist that gets it, all right? And then you just look at the blood pH. That's all you have to do. That tells you whether the person has acidosis, alkalosis. But to get the cause, we're going to look at some other factors, all right? So first, if the blood pH is over 7.45, that you're in a state of alkalosis. Under 7.35, you're in a state of acidosis. Let's look at the partial pressure of carbon dioxide, all right? Remember, some CO2 is dissolved as a gas in your blood. It's mostly traveling how? You should be able to stop right now and remember how? As the bicarbonate ion, all right? But some of it is also in the form of gaseous CO2. That's going to reflect how the respiratory system is doing, all right? In other words, if the partial pressure of CO2 is too low, that means the respiratory system is not getting enough CO2 in. And if it's too high, vice versa, okay? Then we're also going to look at the amount of bicarbonate ion. That's going to reflect what the kidney is doing. So the little brackets, as you may remember from chemistry, that means the concentration of the bicarbonate ion. So those are the two things. We're going to look at those two values from blood gas analysis. In other words, when the respiratory therapist gives us the blood gas analysis, it's going to have the pH, it's going to have the partial pressure of CO2, and it's going to have the concentration of bicarb. Now, it's going to have lots of other things as well, but those are the three that we're going to use to figure out, and this is so awesome, my God, we're going to figure out whether a person has a metabolic problem or a respiratory problem, and whether or not the other system is compensating for it. So it's going to be so damn sexy. You just wait. So in general, whichever component mirrors the pH is the cause of the imbalance. So in other words, if there's a big CO2 problem, then it's probably a respiratory. If it's a big bicarb, it's probably metabolic. But we'll see how to do it exactly. Okay, it's very easy. It can also be used to determine the extent of compensation. So what does that mean? Well, if you're in a state of acidosis or alkalosis, remember, whatever system is not the one who caused it is going to be trying to fix it. So if you've got a metabolic problem, the respiratory system is going to try to fix it for you. If you've got a respiratory problem, then the kidneys will try to fix it for you. And here's the cool thing: we're going to be able to tell whether or not the others. Not only are we going to be able to tell which system is responsible for the problem, we're going to be able to tell whether or not the other system is currently compensating for it or not. It is so damn incredibly awesome. So, in general, whichever component is not the primary cause indicates the compensation. If that component is within normal range, we say that it is uncompensated, that there is no compensation. If it's outside of its normal range, then we call it partial compensation. Up to the point where we completely fix the problem, then we call it full compensation. And we're going to see how to determine then not only who the cause is and whether or not the other system is fixing it, we're going to be able to figure the degree to which they're fixing it. Is that the cat's ass in the moonlight or what? We'll be able to tell whether there's no compensation, partial or full. All right? So, Brondo, it's got electrolytes, the thirst mutilator. And there you go. It's got electrolytes. It's got electrolytes. She's explaining to Not Sure. I think she's like the head of the Department of Interior or something. If you haven't seen the movie Idiocracy, you really need to see it. It's awesome. Okay, bye, kids. Here is a good depiction of what it is to be a complete dumbass. This is at the Grand Canyon. It's on my way to Whitmore Wash. You can see to the right of my truck, see how there's a little faint road right there? And if you look back behind my truck, you might be able to see where they actually fork. And, it had been raining really heavily the last couple of days. A couple times each day. And so, there was water all over the road. And, I'd been driving through puddles for 2 days. So I wasn't really concerned about water on the road. But there's some places where the ranchers know that it gets really bad, so they make a go-around. And I had just passed that, and I thought, I wonder where that road to the left goes. And I thought, oh, no, that's not a road. That's a go-around. At that point, there's nothing you can do. You can't hit the brake. You're done if you hit the brake. You just have to hope your momentum carries you through. My momentum got me all the way to about 15 feet from the end of the other side of the water. So I already used my lockers to make it about 5 feet further to where I am now. I'm about 10 feet from where it's dry again. But at this point, I was completely stuck. So I had to get my shovel out. I took this picture when I first started. I started digging over to the right, on the left side of my truck, tried to dig in the land there. I was going to have to dig a trench to drain the water I was in, which meant I had to go below the level of that water. It was going to take hours. So I had been doing this like for an hour, and a helicopter flew overhead, and I waved, what the hell? And then apparently he was ferrying some people from the end of a rafting trip to the Bar 10 Ranch, which is like 10 miles from here. And so he radioed the owner of the Bar 10, said that I was stuck, and I'm not the first dumbass to get stuck here. And apparently the rancher's a nice guy. I know he's a nice guy. I know Gavin is his name. So he got in his backhoe and came down to pick me up, but I didn't know that was happening. So I'm out there shoveling, and suddenly this backhoe shows up. And from the angle that I first saw it, all I could see were these two little girls in blue dresses with the little white thing. I thought, oh, Jesus, those are girls from The Shining. This is the last day of my life. But it turned out it was Gavin with his 2 daughters. And they just wanted to come along to look at the dumbass. That's what they're doing right now. They're playing a little game called Find the Dumbass. And they both have spotted me. So Gavin was a nice guy, used his backhoe and towed me out. So you always help other people when you're out there. I've given so many people jump starts or, have pushed them or, whatever. When you're out in the middle of nowhere and you see somebody who needs help, you always help them. It's just the way it works.